Behind the obvious physical health concerns this pandemic brings, mental health is a growing concern as well, with spikes in anxiety, depression, sleeplessness being reported just about everywhere. Over the last few weeks, Blue Cross Blue Shield of Massachusetts says more than half of the 500,000 telehealth visits they've processed over the last 6 weeks, as fewer people see doctors in person, have been for therapy and behavioral health issues. I'm joined now by their Associate Medical Director for Behavioral Health, Dr. Ken Duckworth, who's also the Medical Director for the National Alliance on Mental Illness and an Assistant Clinical Professor at Harvard Medical School and BU School of Public Health. Doctor, it's great to see you again. Thanks so much for being here.
Nice to see you, Jim. Thank you for having me.
You know, almost every day when I watch these press conferences, governors and mayors do, they, in excruciating and appropriate detail, talk about the physical health numbers. But with the exception of a moment like Mary Lou Sutter's Health and Human Services social worker yesterday talking about it being Mental Health Awareness Month and focusing on people's mental health, it really gets short shrift, does it not?
Well, Mary Lou's been a great champion, and we're fortunate to have her locally. But I think most people are intuiting this expression, there is no health without mental health. If you're anxious, if you're isolated, if you have a history of depression, getting help is going to be more important than ever.
But, you know, I think the statistic that I've read through the years is somewhere in the neighborhood of 20% of people in this country endure the consequences of some mental illness issue, and only, half of those people end up getting care. So in this moment, when everybody's storming to the gate, what kind of care is available for people who do recognize there's a problem?
Well, Blue Cross, we've noticed just an amazing silver lining in that people are using telehealth at very high levels. It was mentioned more than half of our televisits already were for psychotherapy and related services. And I do want to congratulate the mental health field, which did the fastest pivot in mental health history. It went from a field that did no televisits or virtually no televisits to 99.9% televisits within 2 days.
And well, I understand if the choice is between no in-person contact with a therapist and a telehealth visit, obviously you take the latter. But when you have to change on a dime, is the ability to deliver high-quality services there, or is just the hope there?
I think one of the surprises has been both the patients and the therapists and the psychiatrists like this vehicle. I think this may change how people receive mental health care in the future. You no longer have to drive. You no longer have to pay for parking. And people show up on time on their Zoom calls. And they might be 5 or 10 minutes late fighting for parking. So I think it's a game-changing experience for us all in the field.
You know, one of the things that stuck with me more than anything else in this whole nightmare was from the first few days when I read a story about an anesthesiologist in the hallway in a hospital in Italy breaking down in tears and crying because of some rationing decision he had to make. And while we haven't quite gotten to that point here, one of the things that's getting almost no attention that I've been reading about is not just ordinary people like me who are feeling stress or anxiety or depression, but healthcare providers and the colossal stress. Who's taking care of them?
Healthcare providers need to know they're at very high risk for trauma and traumatic responses. And there are specific psychotherapies that can be given for PTSD symptoms. So the two strategies are essentially reducing your dose of the trauma, and some hospitals are doing very creative loaning staff to reduce the experience of trauma. But I would not hesitate to get behavioral health support. There are treatments that are effective, and it's not helpful to suffer in silence.
What happens for the person who is one step below their belief that they need that telehealth support? What are the things, the tricks of the trade, for lack of a better expression, that one can do to calm oneself in an incredibly uncalm time?
So think of this whole thing as an anxiety provocation, which is activating your sympathetic nervous system and a part of your brain called the amygdala, which is designed to perceive threat. And there is actually threat. We just can't see it, right? So the question is, how do you down-regulate your body? So it's aerobic exercise. It's deep breathing. It's no media after your show stops, right? What are your shows end at 7:30?
7:30. Thank you. I'm
no
glad you got
inputs.
it right. That would have been
It's
horrible.
just like coffee and media. You have to stop your input because it's mostly bad news. It's mostly anxiety provoking. And you have to treasure your sleep because sleep patterns do predict the recurrence of depression, the recurrence of bipolar disorder, the recurrence of anxiety disorder. So do what you need to do to attend to your sleep.
I only have a couple of seconds here, but I want to talk briefly about the future. I know I'm judging by myself. When I'm in a crisis situation, I sort of figuratively hold my breath and try to get through it. And then once you're through it, all hell breaks loose. I'm assuming that's going to happen for a lot of people in this country, sort of the PTSD moment. Are people in your field, am I right, and are people prepared for that explosion, for that moment?
You are right, Jim. We know from returning veterans from the theaters of war, when you interview them the day they come back, they say they're doing great. And 3 to 6 months later, they're having a physiologic response. Bessel van der Kolk wrote a book called The Body Keeps the Score, that even though you think you might be okay, traumatic inputs have impacted your sleep, your thinking, your level of activation. And there is care available for that.
So I want you to know, after 6 minutes of this, I feel like I just completed a telehealth session, and I actually feel a hell of a lot better. I do. Thank you, Doctor.
Well, thank you, Jim. I'm very grateful for you covering this.
Well, I'm very grateful for you participating in it. Thank you so much, Dr. Duckworth.
Thank you. You're great.